The future of healthcare is the future for all of us. And its success depends on all of us working together to create a true system that's focused on the patient. It's a future where we can prevent diseases before we need to treat them. Where we simplify every aspect of how care is delivered and funded. Where information follows patients wherever they go to ensure care is coordinated, more convenient, and tailored to their individual needs.
And this is our vision. My name is Alan, and together with Max, we're going to talk about our innovation, Complex Disease Detector. To begin with, let's put the different causes of death into perspective. As you can see, heart disease is #1 killer all around the world. But the problem is not the disease itself. It's the late detection of the disease that kills most of the people. Now, let's look at what's happening today when you have a symptom. You go to doctors, they examine you, take a blood test, ECG, and in many cases send you for angiography operation, which is very expensive and invasive. And after that, in many cases, they realize it was unnecessary to do angiography operation. During the 2 days diagnostic process, a lot of data is generated. In our invention, we take all these data and employing our unique artificial intelligence algorithm to detect the disease at a significantly earlier stage, even if you don't have a symptom for that. We've even tested our innovation with more than 500 individuals successfully.
Our solution provides benefits for both sick and healthy individuals. It also helps the doctor to make a much faster and more accurate decision, which saves a lot of time and also a lot of costs. It's also enabling healthy individuals to track their heart condition and informs them by sending early warnings in case of developing the disease, even if they have no symptoms. Now let's look at how our system works. Here you have different categories of the data, the different data parameters that you input the data, and the system gives you back a result immediately. Over the time, the system generates a trend based on your medical history and informs you as soon as you're starting to develop the disease. Now to understand that and how we envision it, let's look at a short video.
Complex Disease Detector has been acknowledged many times during the past 2 years. last year, we won the gold medal and the title of Best Inventor within the e-health. And a few weeks ago, we were honored to receive the Innovation Prize from Nobel Academy, the same time as announcing Nobel Prize winner in medicine.
Of course, this hasn't been possible without having a team that shares our values and our vision. We have a fantastic international team, both on the medical side and also on the technical side. As a next step, we're building the next generation of complex disease detector, which we will test it with a big population and then roll it out commercially. We believe that our initiative can transform the healthcare industry by empowering the patients, enabling individuals to track their health, and make the current healthcare systems much more efficient. 4 years ago, our grandmother died because of heart attack. She didn't have any signs or symptoms. You know, when you lose somebody that you love, you start to realize the value of every single moment that you could be with them. Complex Disease Detector is not just a product. We are building a movement to save those single moments. Ladies and gentlemen, please join us to make it happen. Thank you very much.
Just some time for questions and answers by the jury.
Yeah. Hi. I think it's a really interesting thing you're doing. I would have several questions, but I'll start with one. And this is, like, when you analyze all the data, you probably get a lot of spurious correlations. How do you actually, how do you plan that people kind of trust what you kind of detect? How do you assure that this is in a medical kind of quality? All these things, and how actually do you get yourself certain that what you're doing is right, and technically speaking, it's not overfitting?
Basically, I mean, we have 4 professors in cardiology in our team, and when we started from day 1, we started with like 80 different features that can have the very minor effects, and then we started to narrow it down, and then when we tested those 500 individuals, our system was able to detect the sick people correctly. We understand it's not very complete yet, but as a strategy, we are publishing research papers at the same time based on the results. So it's not something like, it's not only on the IT side, it's very strong on the medical side, because in order to make acceptance, you really need to show it's scientifically valid as well, which we are doing already.
Well, to add also, our system is based on big data mining, so it means the more people we test with it, the smarter it gets.
I would like to know, could you elaborate a little bit on how you ensure data security and privacy rights?
Yeah, so basically when we have a slide about that. So if we look at the service design of the system, in the front end of the system you have the individuals here, and then you have the healthcare organizations there. So before we are here, I mean our cloud is here. Before we get your data, basically it just turned out to numbers. So we actually don't know who you are, and we're not even interested to know who you are. We just need to know if you are a man or woman and your age. I mean, these are the most personal identifications that we need to know from you. But otherwise, we look at the profiles. We're not really, I mean, we de-identify the data before we actually even crunch it and make the feedback and give you the result.
Could you just talk a little bit about the challenges that you're facing in terms of orchestrating the network of data and how to onboard those different levels and nodes of data?
Can you elaborate on the question?
In terms of where are you sourcing the data from? You mentioned hospitals, but also you also mentioned in the presentation a number of other sources. And so how do you orchestrate that network and create a better picture?
If I understand the question correctly, you mean that different types of data, basically, right? So, I mean, we normalize this data, if I use the correct term, I'm not sure. So we normalize it, and then we have different categories of the data with different weighing factors. So with our minimum viable product that we have today, we understand which parameters have a very higher weighting factor. So we put them in different groups, so we're not mixing up.
Of course, nobody would disagree with the solution, of course, of reducing the amount of heart attacks. But I got a bit puzzled because your presentation was so slick, especially in the end, like, not doing this for me, for people to save lives. So it got me wondering, so compared to the competitors, slash the the other tools which are non-big data driven, so what is the placebo effect slash the real academic effects of your application?
That's right. So our main competitor that is not data-driven is a company in the US called CardioDX. It's a gene-based blood test that costs like $1,500. From our current results, I mean, we look at the sensitivity of the data, so how many sick people our system actually can predict correctly. So if we compare our system with that, this is more placebo effect because it's around 80%, and our sensitivity is about 97%. So on that side, we are still better. We are far cheaper than this. We are faster. We are immediate result. They take 4 days to get the result, and also we're not taking any placebo effect, or we're not even claiming that, as we discussed over the lunch, we're not claiming that we're diagnosing something. We are pre-diagnosing things for people. So we're shifting back what's happening today just to help the doctor to detect the disease for the patient at an earlier stage.
Well, thank you very much, Max and Alan.